preparedness plans. While going to the hospital can help you recover, it usually has the opposite effect on your finances. So state and federal lawmakers want to change that. Megan Lopez explains.
So in 2016, I was in a bad car wreck and I went to the emergency room.
There are too many stories like Danielle Duchateau's.
A few months later, I was shocked to receive a bill for $12,000.
Too many stories about people showing up at the hospital for help and coming out with massive bills. In 2019, Colorado lawmakers stepped in. They passed a law to try to stop surprise billing in the state.
And the federal government liked our bill so much, they created their own.
The federal version is a little different than Colorado's. So this year, a bipartisan group of lawmakers is working on a bill to align the two.
To make sure that they merge into one simple set of facts for carriers, for providers, and for patients.
It also adds more guardrails around out-of-network provider costs and applies the surprise billing protections to everyone.
When people are treated in the emergency room, they should be able to focus on healing and not have to worry about bills.
A second bipartisan bill gives consumers the right to sue hospitals that aren't following federal laws and making prices transparent.
If a hospital tries to send them to collections or tries to sue them for their bill, they can then have a recourse against that.
There are fines the hospitals could face, but Adam Fox from the Colorado Consumer Health Initiative says they're slow to be enforced.
Sometimes you get laws passed, state or federal, that don't really incorporate the necessary capacity to oversee that.
And this would give patients the right to hold hospitals legally accountable. David Kochell's son Mason,
he has a tree nut allergy, and it's a pretty severe one.
Ended up in the ER last year. He was treated and given an EpiPen.
And a couple of months later, he gets the bill, and the EpiPen was charged at $15,043.
The hospital was partially compliant with the transparency laws. With a lot of digging, they were able to find out how much it should have cost and successfully appealed it.
That's the value of this bill. It kind of gets everything out in the open so consumers can see it.
For lawmakers, the bottom line with both bills:
Transparency won't solve all the problems in healthcare, but nothing can be solved without it.
Megan Lopez, News 5.
Both bills are being heard in the legislature this week. Business groups and Denver Health are opposing the bill that allows patients to sue the hospital. Looking ahead, 9 Health is